COVID-19 pandemic afflicted the world in unprecedented ways. In sheer human suffering, the cost just cannot be calculated. A staggering 4.6 million people have lost their lives. 223 million people have been infected. While the public health systems were overwhelmed, economies worldwide faced downturn and recession. And most of all, the poor were hit the hardest everywhere, whether living in the impoverished south or the affluent north. For the first time in 20 years, the world saw a rise in absolute poverty. We in Pakistan adopted a calibrated strategy of smart lockdowns with simultaneous focus on saving lives, securing livelihoods, and stimulating the economy. A very difficult road to navigate. Our social protection program, which was called Asas Compassion, helped millions of families to survive. I also launched a global initiative for debt relief to help create fiscal space for developing countries to mitigate the negative effects of the pandemic and achieve sustainable development. The advent of COVID vaccine in a relative short time is a miracle of science. We believe science should continue to guide the world's efforts as it combats the pandemic. Attempts to politicize the question of virus origin should be avoided, as it is divisive at a time when the world needs to unite. The vaccine should also be available to everyone on equitable basis as a global public good.